If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
Whether it is sunny or it is rainy, happy Saturday morning to you! And what a rainy crop over we have been having so far. They say it's global warming. So whether it is global warming or whatever it is, every minute you look around, you're getting a weather notification from Sabu and the Met Office telling you prepare for bad weather. But on Saturday mornings, you get a different notification, a health notification, in the form of the next 15 healthy minutes you hear on your radio, all with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and our brand new sponsor, Republic Bank. They are the bank for you. And in case you doubt me, listen to this.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
Republic Bank, that is the bank for you. Let's have a hand for Republic Bank, yes! Looking after the health of diabetics and pre-diabetics at the Maria Holder Diabetes Center. But you should know by now about all the wonderful services that you can get at discounted rates at the Maria Holder Diabetes Center. You should also know about BARP Priority Day. I tell you about that already last week, remember? You forget? Well, let me tell you again. Every Tuesday is BARP Priority Day at the Maria Holder Diabetes Center until July the 30th. And you see what today's day is? 13th of July. So there's not much more time for you to take advantage of these specials that you get at BARP Priority Day, like 10% discount off individual services. So instead of $100 for eye screening services for diabetic retinopathy, you pay only $90. You get $10 to keep in your wallet. And you know it's important for you to get screening every year. So you need to take advantage of this special offer. And then you have vascular screening and eye screening together, valued at $200, but you get it for only $175. All this at BARP Priority Day every Tuesday at the Maria Holder Diabetes Center, a place where you get quality health treatment at substantially reduced prices. So make sure and call and make that appointment. Write down the number 4170305 or WhatsApp 2433937. Now on to today's topic. I started out talking about weather, right? Well, remember last week that Dr. Diane Bradford said that she would be focusing this week on weather tips, especially for diabetics. And you see how we keep getting bad weather? It's because of global warming. You said that already. But the fact is, if you are diabetic, there are some important things you need to know about preparing for bad weather. So, if you know somebody that's diabetic and they don't have VOB on right now, you need to call us so they can turn on the radio and hear these special important weather tips that are especially targeted at diabetics. So, without any further ado, let's say happy Saturday to Dr. Diane Bradford.
Another happy Saturday to everyone from those of us at the Maria Holder Diabetes Center for the Caribbean. We've been experiencing a lot of rain, a lot of wind at some points in time, and we want to share a few extra tips other than the general tips you may be seeing on social media or hearing on the radio if you're living with diabetes or some other non-communicable disease. But always, I think regardless, have some kind of plan, know where your nearest shelter is, have a contact to somebody maybe that you can stay by if you're not going to be in a shelter, have a plan as to how and when you're going to evacuate your house if you need to. And also, if you are living with a disability, as we know diabetes and NCDs can make you more prone to acquiring a disability, you may really want to think about setting up a very solid plan, knowing where shelters are that are accessible with ramps, with disability friendly toilets, but preferably stay with a friend or a family member if you can, so you can stay comfortable. So some questions that you need to ask yourself, and maybe you got a pen and a paper and write this down. Number one is medication. Do you have enough medication? Do you need to have a little bit of extra medication? I think one of the worst things that can happen is, you know, that storm is coming, your medication's running low, and you're going to run out while everywhere is in shutdown. So be prepared. Make sure that you have enough medication.
So Dr. D, what about if you got insulin? How are you going to store it? Because you know you got to keep it in the fridge. What's going to happen if the electricity go off?
Have you thought about how you're going to store medications that need refrigerating in the event electricity goes out? Have a plan to store your insulin. You may want to have a cooler bag which you can put inside of an ice container. Remember, do not put insulin directly on ice itself, as this may actually damage the insulin. But have a plan for storing insulin if you're using insulin. If you don't have access to it, but somebody in the community maybe has a generator, maybe you may think about asking that person in advance if you can store your medication there if power should go out. Have supplies to manage your low blood sugar. Remember, there are some medications used with the management of diabetes which can cause low blood sugar, such as the sulfonylureas, and some of the insulins may be more prone to than others. Also, if you don't know how to manage your blood sugar, make sure you learn how to manage it properly and alert those who live with you, around you, as to how to manage a low blood sugar and what some of the common symptoms of a low blood sugar are. This is something that I think that we can revisit very briefly next week. This is low blood sugar, signs, symptoms, and management. Make sure you have a testing kit to checking your blood sugars, and you have some extra batteries. Once again, we don't want to get caught out with no batteries, no electricity, and everywhere on shutdown. In the event of an emergency or the need to evacuate, know all your medications, know your medical diagnosis. You want to know the type of diabetes that you have. This can have serious implications as to how you may be treated or how quickly attention may be required for you. Okay? And you also want to make a list of these things and put that list in your little waterproof bag with your important documents. Also, please have some form of emergency identification bracelet if possible, highlighting that you may be living with diabetes, or you may be on insulin, or you have other non-communicable diseases.
So Dr. D, when the rain hold up, I could go outside barefoot and splash about?
I want to say shoes. We have spoken about shoes probably every single week. There's no barefootedness in the weather or even outside the weather. No barefootedness inside the house or outside the house. You may be having little repairs going on after bad weather. You don't know what debris has been put down, what little shards of wood. Please don't take any chances.
So I could just put on slippers then?
And no slippers. If you are wearing a dressing for a wound, you really do not want that wound to get wet. We're having a lot of water right now, or the dressing to get wet. If your dressing should become wet, I would caution against using a hair dryer to dry your dressing. Some people I have been informed have told me they've been told they can put a hair dryer at a low level on their dressing. I strongly advise against it. We have actually seen cases of people coming in with heat burns on top of their wounds, making their wounds much more serious and severe through the use of a hair dryer. Remember, when you put a hair dryer on a bandage that's wet, it's going to generate heat, and you really don't necessarily want that against your wound. So just be very careful, and absolutely no hot hair dryers at all. The best thing to do is actually to remove the wet dressing, cover it with gauze, strap it up or bandage it, and see how quickly you can get that dressing replaced. Make sure you have a good supply of clean drinking water. Not only may we not have water, but it's gonna be hot. So you want clean drinking water, and water that's collected from other sources, and maybe you use it for, obviously the toilet and wash and other things. But where you need to drink water, please make sure that water is clean. And once again, seek prompt medical attention if you sustain any form of injury, or if you're unwell, as soon as the all clear is given. There will be emergency numbers around if there isn't an all clear but you're having a medical emergency, or you can call your trusted care providers or our local hospital for advice. Just some general points I want to remind you of. Do you have sources of light, extra lights, batteries? We mentioned water already. Limit opening and closing of your fridge, especially if you have insulin in it, because you don't want it to cool down too much or get too hot. Unplug all your electricals. And once again, I can't reiterate enough, please wear proper shoes. And also please stay indoors during bad weather. I saw a very disturbing video with a lady trying to hold her galvanized roof that was flapping wildly about onto her house. We are grateful that she's safe, but she could have easily have lost her life. And remember, charge your phone fully, and if you have battery packs, charge those as well. We urge you please to be safe during this season, and any further information that you may need, please ask your care provider or feel free to contact us for the information. Thank you.
Thank you, Dr. D, for all those helpful tips which will help diabetics when the bad weather comes. Thank you very much. May the Lord bless you. And we are now about to play our song of the day, and for that we go all the way back to Crop Over 2018. The artist is Bobo, and this is a song mixed by Anthony Lohar. This is Wayne Compliments the Maria Holder Diabetes Center and Republic Bank.
Mighty Jaja we bring, let peace reign, let peace reign, let peace reign, let peace reign. Good vibes reign, good vibes reign, good vibes reign, good vibes reign. Soak out, fill up the cup and soak up on top of handy drink. Don't talk about the drinks, now handy drink. Don't talk about the drinks. Baby, how you get so hot, cheat? Tell me, left out the long talk, got the chit chatter. You're looking for bitter batter. I ask what is that you mean, she get on like sheep and repeat, cut the chit chatter. You really want bitter batter.
Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
So I up on the rooftop, any atmosphere of a carnival, you get showers of bacchanal, fed like rain, vibes like rain. And we chanting rain, rain, come down and make the whole of Bridgetown bring showers of blessing, and bless up the system. Rain, rain, come down and make the whole of Bridgetown for the mass we play. Mighty Jaja we bring, let peace reign, let peace reign, let peace reign, let peace reign.
Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
Don't talk about the drinks, no handy drink. Don't talk about the drinks. Drinks all more like raindrops. Pounding me head top. If the rain starts falling, let it rain, let it rain.
The Maria Holder Diabetes Center.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
Drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality.